this, but I can hear them speak inside their mind. देख लूँगा तुम सबको, जीतने के लिए आया हूँ आज यहाँ पे। इतनी बारिश में एयरपोर्ट से या ट्रेन स्टेशन से यहाँ तक आने में मुझे दूसरों को जिताने के लिए नहीं आया हूँ मैं यहाँ पे। जामनगर गाना गाने नहीं आया हूँ मैं, जीतने आया हूँ। रियल जीतने आए, लकी गर्ल जीतने के लिए आए, ठीक है। आई एम अ वेरी स्ट्रिक्ट क्विज मास्टर। मैं कुछ भी चीज टॉलरेट नहीं करूंगा होम टीम की फेवर में, पहले ही बता रहा हूँ। इफ आई सी somebody prompting, I will immediately cut marks for the home team. Is that fair? Fair? Home team supporters? Fair. Second thing what I will do is I will use some of my rules so that it becomes a fair quiz for everybody. हम क्या करेंगे? We will have, if one team is unable to answer the question, this for the scorer to note as well. If one team is unable to answer, I will pass the question to all three teams. You will not speak the answer, you will write it down, give it to me, and जो भी सही बताता है, I will give them the marks, half marks. ठीक बात है? Otherwise ऐसा होना कि एक टीम को undue advantage मिल जाए. Okay? Is that fair? Good. दूसरा. जो पहला round होगा, my first round would be a single word or one word answer or one line answer. So I'll just put the question to you. I will start with the team A, which is I will artificially label as this as A, B, C, D. Is that fair? A, B, C, D. Okay. So the Ames team. Now so, are you all set for the round one? I don't hear you. Do you want to get lucky? Let's see now. First question to you. Let's see. A 20-year-old man presents with pain in the elbow. On examination, he showed positive Yergassen test and positive speed test. What is the most likely diagnosis? Your time starts now. Yergassen test and speed test. Pain in the elbow. What could it be? Quick. Other teams, start writing. I don't think they have the answer. Please start writing. Yes.
You're going to get 10 seconds.
10 seconds for the question. Golfer's elbow. I don't think so. Let's see. They have not written anything. She's happy to be here only. I do not wanting to answer. Huh? Allah no palsy. Unfortunately, incorrect. Dislocation of the elbow. Could not be so easy. I don't think any team gets any marks here. This is bicipital tendinitis. Yergassen test and speed test are done for bicipital tendinitis. Please remember. Okay. Now let's go to team. Next team. Team from KMC Manipal. Are you ready for your question? Yes? Are you listening to me? Yes? Okay. In a child with cavernous foot deformity and standing lateral block test, also called as Coleman, C-O-L-E-M-A-N, block test, assesses the flexibility of which part of the foot? What do you think? Standing lateral block test, also called as Coleman block test, assesses the flexibility of which part of the foot? What do you think? The time starts now. Manipal, what do you think? Rest of the teams?
Time's up.
Time's up. Let's see. What do you think? I don't think so. They don't want to attempt only. I don't know. Answer is, I don't think any of the team gets the answer here. The answer is hind foot. Coleman test is for the hind foot part of the foot. Okay. Let's see the next question. Next question. West zone. Jamnagar. Are you all set? Let's see. A 58-year-old man has a brain lesion that causes him to feel euphoric, laugh uncontrollably, joke and make fun. Where is the brain lesion located most likely? Laughing uncontrollably, making jokes and fun. What do you think? Jamnagar. Very easy question. Which part of the brain? What do you think? What do you think?
Frontal lobe.
Can you? Clock is running. Three central. The rest of the things. Let's see. What do you think? Okay. What do you think? Okay. All three teams get it correct. It is prefrontal cortex, and I think all three teams get 3 marks other than the team that I put the question. They did not answer. All of these will get 5 marks. Okay. Everybody got it. So next time, whenever you know the answer, don't speak. They might have heard your answer, and you are here to win. You're not here to time pass. Okay. Okay. I'll go to you. Okay. Team from Odisha. Do you want to listen to your question now? Are you or yes? Yes. A 32-year-old patient is being interviewed in his physician office, and he responds to each question, but he gives long answers with great deal of tedious and unnecessary detail. What is this symptom called as? Final year medical graduate giving a viva. The teacher is asking one question, but he is giving long details. What do you think? Long answers with the time running. Confabulation. Unfortunately, that is not the correct answer. Let's pass it on to the rest of the teams. What do you think? What do you think? They don't want to write anything down. You have written anything down? Let me see. Confabulation. You should not have written the same answer. You're wasting your chance. They don't know. Only team from AIMS gets it correct. They get 5 marks for this. Answer is circumstantiality. Very good. Very good answer to give.
Sir, sorry to interrupt you here. I have great pleasure here and trying to welcome our chief guest for the day, Dr. T.S. Rao. Thank you very much, sir, for coming. I may kindly request you to take your seat here in the chief guest chair. Thank you very much, sir. Thank you very much, sir. We'll come to Dr. Rao's introduction in some time, sir, in the mid of first round. Once we do that, we'll come back here. Sir, all yours.
Team from AIMS, are you ready for your next dance?
No.
If there is a negative marking, I tell you. No more. As of now, no negative marking. So you can play your answers. Are you ready for your direct question? Jesse. A 72-year-old man has been treated by a neurologist for Parkinson's disease for past 2 years. 1 week after his last visit, he called his neurologist, reporting that he has suddenly begun to see little people walking all over the furniture. What is the most likely cause for this? Parkinsonism, treatment. 1 week after the last visit, he is seeing little people walking all over the furniture. What do you think is the cause for this? The time.
Time is running out.
Time is running. They are discussing here amongst themselves.
Time is up.
Complex calculations. What do you think?
Insufficient dose of levodopa.
Insufficient dose of levodopa. Insufficient means less dose of levodopa. Okay. Let's pass it on to the rest of the team. What do you think? What do you think? It is a very good chance to get marks. On or off? I don't think so. What do you think? Huh? Okay. What do you think? What do you think, KMC Manipal? Speak up. Lily Putin from. I think the answer that I have is it is over increased dose of levodopa, not under dose. So if you had said inaccurate, I would have given you. But I asked you categorically, and I have given a clue to the rest of the teams, but you could not buy that clue. So I don't think any team gets this mark. No marks for anybody. Okay? So that is how you get. Okay. KMC Manipal, direct question for you. Let's see if you are able to tell this. Very simple question for you. Okay? Because you are lucky to be here, I want to give you a good luck, easy question. 41-year-old patient reports periodic bouts of lightheadedness and confusion. His blood tests fasting shows blood glucose is 45 milligram per deciliter. Plasma insulin is found to be markedly elevated, but plasma C-peptide is undetectable. What is the diagnosis? Are you sure? Insulinoma? Are you sure? Okay. Let me pass it to the rest of the teams. You did not find the right. There was a good clue in this question. Rest of the teams. Let me see. Okay, AMC. Okay. What do you think? There's a lot of calculations on your paper, but no answers. But I want the correct name for this. Correct name. Other team has written the correct name for this phenomenon. You have the name? Okay. I am not going to give it to you. Only the Ames teams get this answer as correct. This is factitious hypoglycemia. I wanted you to notice, I spoke again, that C peptide is undetectable, but insulin is more. Okay, so it has to be factitious hypoglycemia. Okay, let's go to the next team. Team from Jamnagar, your direct question. Chance to win 10 marks. Okay, let's see. 38-year-old female presents with new onset of multiple pruritic skin lesions. Pruritic. Okay. 2 years ago, she developed late onset asthma and mild hypertension. Lab investigations show eosinophilia, and biopsy of the skin lesions show leucoclastic vasculitis. No perivascular IgA deposits are found. They are not there. And ANCA is positive. ANCA, ANCA is positive. What is the most likely diagnosis? Easy question. Church-Strauss. Are you sure? Lock kar diya jaye. Very good. You get full 10 marks. Good marks. Very good. Now there is a request that if anybody is not able to answer, please put it to the audience. I'll do that. Okay. Now let's come to the next direct question for team from Odisha. Are you all set for this? Are you all set? Let's see. 22-year-old male presents with complaints of recurrent episodes of frequency of passing stool around 10 to 15 per day. There is blood and mucus in the stools for past 5 years. Associated with abdominal pain, joint pains in the knee and ankle, and ulcerated lesions over the right leg for 6 months. His ulcerated lesion, there is joint pain, diarrhea, abdominal pain, and ulcerated lesion on the right leg for 6 months. His skin lesion is most likely to be. Do you follow my question? Any query? Okay, your time starts now. Pyoderma gangliosum, lock kar rahe hain. Good. Can I give you some results? Now, last round of direct questions. We will do one more round of direct questions for the team. Team Ames, are you ready? Okay, the direct question for you. 18-year-old presents with digital gangrene involving the third and the fourth finger for the last 2 weeks. On examination, blood pressure is found to be 170 by 110. But all peripheral pulses are palpable. Blood and urine examination are normal. Anti-double-stranded DNA and ANCA are negative. Most likely diagnosis is. Very simple question.
Your time starts now.
Digital gangrene. All pulses are palpable. ANCA is negative. Now think of it. I've given you very clues. Quick. Should I pass it on? What do you think?
Time is up.
Polyarthritis noda. Just at the borderline, they have given me an answer.
Yes.
Should I take this answer?
Yes.
Yes, it is absolutely correct.
Correct.
Full 10 marks.
Round of applause for the home team, please. Thank you very much.
Okay, Mr. Manipal, you're ready for your direct question. Okay, let's see. 16, I'm giving you an easy question again. 16-year-old presents with abdominal pain and fever. 16-year-old, abdominal pain and fever. Examination reveals a tender adnexal mass. On further probing, there is history of multiple sexual partners with irregular periods and vaginal discharge. What is the most likely diagnosis? Vaginal discharge. Now tell me. Your time starts now. Mass is what my question is. What is this adnexal mass likely to be? Very good. Tuber mass. Correct. This is
That's the correct answer.
Very good. Correct. They get full marks for this. Okay. Now let's go to team Jamnagar now. Last direct question of this round for you. Are you all set? Are you all set? Okay. Okay. A very easy question for you. Okay. 2-week-old infant. Whenever I see easy, probably I'm seeing something naughty in the question. Okay. So don't mistake my easiness. 2-week-old infant presents with apnea. Infant was born at term after an uncomplicated pregnancy. Mother of the baby had rhinorrhea and cough that started 3 weeks ago, and now she has severe persistent cough with post-tussive emesis. Which antibiotic is most suited for her condition? Yes, what do you think? His mother has rhinorrhea and cough with post-tussive emesis. Which antibiotic is suitable for the mother in this case? Now you understand the question. What do you think? Very easy question. What do you think? Jamnagar.
But I think third generation cephalosporin.
He says third generation cephalosporin. I have to pass it on to next team. What do you think? Okay, let's see. Let's come back to it. I think I'll give it to all three teams as 5 marks, but they're given azithromycin or methadone. But answer that I have is azithromycin. Probably it is. She's a lactating female who was 2 weeks old, so you have to give the same group you have mentioned. So I'll give marks to all three teams, other than the team that I asked. All these three teams will get 5 marks each. Last direct question of this round. Okay, Team Odisha, are you all set? Let's see. Little difficult question. Patient with chronic intestinal pseudo-obstruction has action potential and large amplitude contractions of the circular muscles associated with every electrical slow flow at all levels of the intestine. Dysplasia of which cell type most likely explains this patient's condition? What do you think? I'll again repeat. I told you this is a very tricky question. Patient has chronic intestinal pseudo-obstruction with action potential and large amplitude contractions of the circular muscles associated with every electrical slow wave at all levels of intestine in the interdigitate state. Dysplasia of which cell type most likely explains this patient's condition? Which cell type has the problem in this patient? Patient has chronic intestinal pseudo-obstruction. What do you think?
Your time starts now.
Should I pass it on?
10 seconds running.
You have won before in Chennai. Don't you want to win in Delhi? Tell me.
Time is up.
Okay. Time is up. Let's pass it on to the next.
Sir, I'll go to that. I'll do that.
What is the answer that you have? Oh, let's see. Okay. Let's see. What is the answer that you have? Any answer you have? No. Unfortunately, I'm not giving it to any of the teams. Answer is.
Sir,
let us put this question to the audience, but I don't think.
Anybody in the audience would give it a try? Anybody here?
Wrong.
Answer that I have is.
Sir, let us give it a one more try. Anybody? Yeah.
Parasympathetic nervous system.
So is that correct?
Yeah, the answer that I have with me is inhibitory motor neurons. Inhibitory motor neurons. I'll ask my surgery team, are they audience? Okay. One more question to the audience, and there are exciting audience prizes to be won. Okay. Let's see, audience. A 14-year-old boy comes to you with sore throat and fever. On examination, he has pharyngeal erythema and tonsillar abscess. Throat culture reveals gram-positive colonies which cause hemolysis in sheep blood agar. This organism grew well on mannitol salt agar and it turned the medium yellow. What is the most likely organism?
Anyone?
Yes, audience, yes.
Give us the one.
Beta hemolytic streptococcus is what you are answering. That is not the answer that I have.
That's not the answer. Anyone else? Yeah.
Very good. It is the correct answer.
Correct answer.
First audience prize.
This is for you. Thank you very much.
Now once I see the prize, I give the result for round 1 so that we can go on to the next round.
I think.
Go on to the next round.
No, sir. We just. I was just want to share a few more things here. I would say this quiz is not a quiz of the medicos, for the medicos and by the medicos. I would like to share a fact here, sir. All these questions have been framed by a student of DAMS, an ex-student of DAMS. He has taken a lot of pains and made these questions. We did that deliberately because if any of the faculty or any of the seniors would be making it, might have been a chance that could go on the difficult side. So we chose one of the students of your age group and your professional group to make these questions, right? I think all my contestants here are not feeling the heat yet. I tell you, there are only 6 rounds. 1 round is over, another 5 to go.